So this is where we come to the proposals for gender budget. What is gender budgets? We have two ways of using gender budgets, analysis and design. It is a transformational tool if you know how to use it. I am coming up here with some central notions in which we can use gender budgets. And in the context of the 2030 agenda, how is it that the gender budgets are related? In 1995, the first experience of gender budgets took place in Australia. A group of feminist NGOs got together to analyze the impact of public policies in the life of women. So they were analyzing the programs of the Australian government, and they were just doing the tracking. What programs have in its title the words women, girls, widows, those semantic fields related to women, and they were analyzing how many budgetary allocation did the program have and what was the impact in the population. The UK was second, following the exercise, and by 2002 we had the first methodology in designing gender budgets, meaning that you're not only analyzing the programs that the governments are making, but you're also shaping the programs from inside with a methodology to change the program so that the budgetary allocation is a qualitative allocation. This is why I'm saying here that gender budgets is a tool involving programming and budgeting. It's not about the money. People always think that budgets, it's about the money. It's the other way around. It's about the actions. Because when you have a program or a project, you say, we're going to deliver a workshop in the center of the city, your budget is for buying coffee, for the oil, for the gas, for the car to take the people. So you're paying for the actions. You're taking people into transportation, and then you give them the metro card, or you keep paying for the gas. And so all those issues are behind the money. So when you're doing gender budgets, what you're actually doing is reshaping the program. And we are always saying that a budget is a declaration of your priorities. And this is what happened in Mexico when we started. We were asking the mayor on the day of violence against women, because he was saying, yes, violence against women is a priority for us. And the question was, how much are you allocating to eradicate violence against women? And of course he didn't know what to say, and because we were saying, if it's a priority, you have money for that. You have money, which is what happened with the military and security sectors. They will always have a huge allocation of money, because that's actually the priorities of any government. So you just need to count where the money is to figure out the priorities. So what we're trying to do is precisely modifying the programming and reallocating the budgets to modify the negative impacts of inequalities in the lives of women and men by means of addressing. You need to find out where the gender inequality is, and you need to target the actions towards diminishing those inequalities. That's how we do it. So I'm going to focus more in the design of the gender budgets rather than the analysis, but there is a compound, and the compound refers to the faculties and the mandate that the legislative branch has, as opposed to those that the executive branch has. Given that they have different mandates, they relate to the budgets in different ways. So just to say that this is a transformational tool if and only if you're abiding by these principles or by these criteria. First of all, gender is not women. Because since the beginning of time, since the beginning of states have been delivering policies for women. They're mothers, they're prostitutes, they can be nurses. So there are policies for women all the time, since the beginning of state. It's not a matter then of devising policies for women. Actually, if you're doing that, stop it because you're duplicating the work. The state doesn't need more hands to help in the deepening gender inequalities. They're doing very fine on their own. So we need to do gender policies in order to change that order that states are replicating every day. Because the states are devising their policies based on the sexual division of labor. Men go out to work, women take care of the people, and that's the idea, that is their underlying premise for public policies. Institutions are actually gendered, so you see that security, prisons, all of those engage with a male population, whereas education and health, those are addressed to the female population. So this is very important. It sounds very simplistic, but it's the truth. So all those policies addressed to women are actually the cause of deepening inequalities, and they are deepening the circle. The other issue that we need to highlight is that persons, women and men, are diverse. Maybe you have heard of this term intersectionality, which is totally absurd. It's absurd because gender relates to people with bodies, and bodies have age, and they have race, and they have disabilities, and they have bodies themselves. You don't need to do any intersectionality, because the abstraction of a woman and of a man is just in our minds. You need to know that a woman sometimes is a baby, and then she grows up and she's a girl, and then she grows up and she's a young woman. I mean, it doesn't take rocket science to know that. If you're only devising policies for adult women or for adult men, it's your misunderstanding of the notion of gender. You don't need an extra ad that is theoretically so complex, because women and men are diverse. So when you're working with gender, you always need not only to disaggregate by sex, but by age, and by many other human conditions, all of them, whatever is relevant in each of the sectors. Because when you're relating it to the topic, of course there are some groups that are more crucial than others, just because their engagement, and because also of the structural inequalities that the groups of population have. So you know, you have to be mindful of that. Indigenous people, people with disabilities, people of African descent. You know, you have to take an eye on those qualities. But there are many. So you should start from diagnostics, to review your actions and allocation and evaluation of process and results, bearing in mind all those groups of population. A gender budget is not about women and men. It's about the specific groups of population, and by differentiated action, because humans have differentiated needs and interests. We all have the same human rights, but our exercise differs in the situation and condition in which we're placed in our society. So the state needs to be mindful of all of those conditions and situations. This is what gender budgets is about. If you only have a measure for women and men devoid of diversity, that's not gender budgets. We really need to be very critical about it. And as I was saying, the sexual division of labor is at the core of gender inequality. I'm not sure if you are very familiar with this, but let me try to explain it very quickly. What generates the value of everything in the world is human work. Not the value, the monetary value, but the work. If we have a piece of wood, what's the difference of the value with this wooden table? It's not that it was paid for, it was that it was transformed by human work. You remember your Adam Smith and your Marx and all those classic economics. And that's true. So whatever that comes and circulates in the market, that is the result of goods and financial circulation, is just a part of the value and the production generated by human work. There is another part that is not paid, and that has to do with unpaid domestic and care work. When you're having breakfast in your house, when you are sick and you stay home and someone takes you chicken broth so that you can feel better at night, or when someone is doing the dishes, that's unpaid domestic and care work. If you were to pay a nurse, a cook, a chef, and a dishwasher every day for every moment of your life, there would be no money in the earth to pay for that work that is produced at home. And the figures are astounding. 60% of the value that circulates in the world is produced by unpaid domestic and care work. 60, meaning there is not enough money in the world to pay for that 60 because the money only accounts for that other 40%. Meaning as well that if men would stop working for a week, guess what? The world is not gonna crash because men are mostly working for paid work. They're engaged in this 40% of value generated in the world. And not all of that, because women are generating paid value as well, because we're going outside and we have jobs. So that 40% is produced by women and men, but this 60% is mostly produced by women. The other implication of this is that women subsidize the entire economy. Unpaid domestic and care work logic is the modern notion of slavery. And it's a slavery in the name of love. Because you love me, you have to cook. Because you love me, you have to take care of me. Because you love me, you have to wash the restroom. That's what women do. I don't know of any type of love on behalf of the men that takes them to the point of washing the restroom. But that happens all the time in the case of women. We have time surveys in which we have asked women and men, what do you do when you get up in the morning? How do you use your time? In all cases, all over the world, women are working 3 shifts. One, for assuming their commitments under the sexual division of labor, they take care of people. Then, after they take care of that, is that they have a life. They get to choose one part of life. Sometimes they choose to have education. Sometimes they choose to go to work. But for instance, if they choose to go to work, then they would choose not to have a decision-making position because they have to go early to take care of the kids or their ill brother or their elderly that is living over there. So they have to choose because the first task of unpaid domestic and care work is coming first. And this is a decision. What about if I'm 25? Should I get pregnant or should I pursue my master's degrees? That's a decision that men don't have to have. What if I'm a deputy? Oh no, I can't accept running for senator because my aunt is ill. That's what a deputy told me in Mexico. I haven't heard a male senator saying, oh no, my aunt is ill. I'm sorry, I'm not running for office. That's what happens. Women make use and exercise of their rights after they take care of their unpaid domestic care roles. And the third shift is to struggle to eliminate the sexual division of labor. Because men are accusing us all the time of being disruptive, of being feminazis, and such. So we are fighting 3 shifts, and men, the thing is, people are always saying, but the world has changed. Yes, because women have moved, but men have not moved. So we are undertaking the tasks that previously were done only by male, but the men have not moved to redistribute unpaid domestic and care work. Meaning that then the inequalities go deeper, and it's not because, oh yes, women, you were better back then when you were staying at home. No. Men should also be entitled to stay at home, but it's not always nice to do the dishes. No one wants to do the dishes, but it's not fair that women have to do the dishes and renounce to their life. So this is about rights, because women have a mandate and men help. So in this regard, this agenda of the sexual division of labor is very important. And this, let me give you an example, because this is the core of what even well-intentioned NGOs and governments are doing, and what they're actually getting as a result is adding an extra burden on women. We want to enhance women's political participation in a communitary project. So we want to, our indicator is number of women, parity, 50 and 50. So you bring about the women to your project, but you're not asking, do you have someone that you're taking care of at home? Do you have someone who will help you with that? Because what you're doing by bringing women into your project is that they're asking their neighbor, can you help me with the kids? Yes, and I'll take care of yours next week. You're adding an extra burden on women because you're not, first of all, you're not helping them how to negotiate their time with the man who's in their house or with the rest of the family, but you're not adding, maybe that's too difficult, but you're not putting a special place for care so that women have a safe space for that. So this is maybe a very simple example, but when you have education and they say, come the mothers to help us clean the school, and health says, come the mothers to vaccinate their kids, and civil protection says, come, let me show you how to, on water and sanitation, let me tell you how to chlorine the water so that the family is drinking safe water. And civil protection says, let me help you cleaning the water for the Zika, to avoid Zika. So everybody is calling on women, because women will work for free. The moment in which you're calling the men, they are asking, how much are you going to pay me? And they're right, because you know there was a human rights movement that is called the labor movement, in which it says you're entitled to a salary, right? It's women who have not been aware of that fact. So the state knows that women are not aware of that fact, and NGOs know that too. And we're always using voluntary work by women. And we're always asking women to come without minding of their time use. So this is very important, and this is what I'm saying, it's not about women policies. And everybody's like, yeah, it's the state, it's the other one who's doing women policies. No, you should really review if you are promoting women's policies. as opposed to gender policies, because this issue about unpaid domestic and care work is at the core of gender inequalities. It's not about access to participation, it's not about the salary gap, it's about the time use. So, how are we addressing the challenges? The gender budgets is really a methodology to change the programs, and it has to do with disaggregation of data, so it will enhance and strengthen the capacity of institutions. And it works not only at the level of statistical commissions or entities, it also works at the level of local and sectorial level. You can work in a municipality or an entire sector, in the micro, meso, and macro levels, in the 3 branches of government. And for instance, you can accelerate the fulfillment of the SDGs by working with this methodology for each indicator, because you will have differentiated actions for every group of population. And for each of the goals, with an inherent promotion of the human rights frameworks. And this is something that's very important. I think the slide doesn't show up very properly, but it says that gender budgets allow for the proper fiscal ways in which you will mobilize and you will channel the international finance and cooperation. Because sometimes you have the external aid, for instance, and it comes straight to the UN system, and then it goes to intermediaries, and when it comes to the community level, you only make it like 20% of the 30% of the money allocated from the start. But if you run it through the gender budgets, you are going through the official fiscal way, and it goes pretty much, yes, right after it goes to the Ministry of Finance, it goes straight into the implementation. So you are eliminating the intermediary, that is all of those entities that are living out of aid and avoiding the actual process of implementation. So this is a very bold and simple proposal. There is money, it's the national money, and it, I think, has the potential to be one of the most effective ways in achieving the SDGs. Only, this is a very important thing, we really need to address the global challenges I was referring to in the North and South divide. Without that, there is no nation or entity capable on its own to achieve the 2030 agenda because of the structural challenges. We're all facing structural challenges. So this is really important. So what's the methodology for gender budgets? You have a gender diagnostics. First of all, you ask for the differentiated conditions of population and specific inequalities. Then you go for an analysis that has to do with the sector and the theme. Let me put you an example. I'm gonna go with the National Registry. We were training the National Registry, and they said, you don't need to come here to train us on gender budgets and gender equality because everybody needs a certificate birth, where regardless whether they're women or men, they all need a certificate birth. Okay, yeah, you're right. But let us count how many women and how many men are coming here to your office. No, it's just the same because it's the same number of population. Okay, let us do the math. So they were saying, we don't know how many women and men come, and this is very boring, but let me tell you what I will do. I will allocate 3 windows for pregnant women, people with disability, elder population, and that will be my gender budget program. And we were saying, well, that's fantastic. How much money will you spend on that? $1. I just need a sheet of paper, and I just take a roller, and I just put, this window is for people with disability, pregnant women, it's fine. So they did that, and we came back the year after to follow up what happened. They were really surprised. And because they had to fill in their the program, the sheet, the format. So we were saying, okay, what's the number of population you think you will be reaching with $1? 1,000 people. Okay, 3 windows with $1 for 1,000 people. Sounds like a very good program to me. Well, we came back the year after and we asked how many people showed up. Can you imagine? 80,000 for $1. And they were really surprised. They said, we had no idea. So many people with disabilities, so many elderly population, so many pregnant women, and we had them standing in the queues for hours. Not that we know, not that we have the data disaggregated. Of course, we're gonna open more windows for them, but now, because we saved budget last year, we will have mobile unities to go to the plaza so that people can come and they take their certificate birth and all of the information they need and the procedures, because it's so hard on them to come. So they were, in 1 year, totally transformed because they had the information, they had the awareness of the differentiated type of action they needed. Because you really need not only to have the access to the differentiated conditions of population and specific inequalities, but also the sectorial and thematic gender analysis. Let me put a different example. We were training the water and sanitation sector, and we were talking about gender inequalities and stuff. And then at the end they said, you're very right, we're going to devise a program on violence against women. And we were like, okay. So let me ask you something. You have trained staff to deal with women who had suffered violence? No. You have specific settings, infrastructure, in which you will put women who have suffered violence? No. You have money to work with women with violence? No. So what do you have? And you have a mandate to work with women's violence? No. You have money for what? For water. Okay, let us go back and ask, what is the relation with women and water? Because you have trained staff, you have the infrastructure, and you have the mandate. So let us address the gender inequalities with your sector. Because they think this is really important. When you think about gender inequalities, you think violence. You think the gender gap. You think health. But you don't think in infrastructure. You hardly come up with the link between energy and women, oceans and seas and women. It's very difficult for people to make the connection, even for people who's devising the policies. So you have to walk the path with them to make the connection and to not only analyze the inequalities that women are suffering, what is the relation between those inequalities and your own sector and your own program? And how is your program going to diminish the inequality gap? Because you have a specific mandate that no one else has. You have a specific capacity that no one else has. Then how are you going to do it? That's the main question in linking the sectorial and the themes with the specific inequalities. And then you go to the programmatic revisions. You have an existing program. We, in Equidad, my NGO, we never come up and say, you need to do a new program. Because it's like someone comes and knocks to your door and say, you do an amazing work. I'm coming here to present you a new project. You need to implement it this year. It's like, what? That's what civil society does all the time. They come and say, I'm giving you a new idea for your government to implement. We love doing that. But governments, they're doing their stuff, for a reason. So you come and say, come on, bring me your program. We'll review your own program because it's working. It just needs a small improvement. You are going to do it. I'm just here to help you to facilitate, but you're going to be the one who's doing it. So we review the actions, and then you compare the actions with the result, the outcome of the diagnostic. And that's when they say, oh yes, women Well, you see, for instance, let me tell you another example. This one is very good. We came to a fund for economic project. We came to ask, so what is the sex disaggregation of your population? Oh, no, we take care of women and men in the same way. Well, let me show you. Come, bring your sheets. Let us count how many women and how many men. The same, okay, let us count. 80% of the program was allocated to men. But also, men had more allowances to borrow the money, and they had longer periods of time to bring back the money, because men are the providers, right? So we were asking, so 80% of the money was allocated to men. And they were really shocked to see that disaggregation. And when we came to the actions, it turns out, for instance, that they were always requiring to fill out this form, that you had an identity proof. And many women, especially rural women, they don't have their identity card. It's very hard on them to deal with technical terms. So they had to change their actions so that it's not about, yeah, but they don't come. Of course they don't come. If you are asking them for their identity card, why would they come? But you know that structurally, rural women are not going to have the card. And this is precisely why they need your program the most. So if they change their actions because they have the diagnostics, then they know that with women, they will have someone sitting outside helping them to fill out the format and having a different set of requirements so that women could have access to the program. And then they told me, because we come to the reprioritization of actions. What's the total capacity? What is it that you can do? Because you can come up with many ideas, but what is it that you can do? And they said, for the next years, we will be only engaging with projects with women so that we can reach 50-50 in our population. And we came after 8 years, and they had achieved the 50-50 balance. That was a very, very nice thing to see. So you have the budgetary reallocation. It's not that you're changing your activities. You're just reallocating the money. You don't need an extra money. I think that $1 program is the best example. It's not about more money, it's about best money. And finally, which is very important, is that you have relational indicators. I'm not sure if you're familiar with gender indicators, but gender indicators are always relational. Whereas in other traditions, you have one indicator measuring one issue. For the gender gap, you need to make always a comparison. Number of women versus number of men, or number of indigenous women versus number of mestizo women, in the case of Mexico. You always need to have a comparison. This is why gender indicators are relational, because you want to measure the gap, not the specific. We covered with this program 1,000 women, I don't care, as opposed to what? You measure the relation with gender. So you always need 2 sets of data, and to have that as your baseline, and to follow up through the process, through the result, and to the impact. And this is really important, the process. The process is perhaps the most important thing. Let me give you the example of transport. In Mexico City, we trained the transport system, and they had a survey of violence against women in the transport, and 75% of the women in Mexico City had suffered some sort of violence or harassment in the subway. We're one of the biggest cities in the world. So what we were devising in the workshop was, they said, there is no way in which we can know how many women and men are having access to the subway, because transport they don't get to ask you what's your sex, as opposed to health, in which if they ask you, did you have sexual intercourse today? And you are obliged to say yes if you want the service of health to be of any use to you. In the case of transport, they don't even get to ask you what sex you have. Do you have access to the facilities? But then, how were they going to devise a program in addressing the outcomes of that survey? They came up with the idea of using the first 2 wagons of the subway for women only, and for kids, and for people with disabilities, and for elder population. So, at peak hours, we have the differentiated transport. And then next year we came up, and the rest of the transportations followed. We have some 17 types of transport in Mexico City, of which 7 have differentiated measures for gender equality. But then there was one, which is buses, all single buses for women. And at the 3rd year, we came with them, and we were asking, how is your program? And the director, she was a female director, said, it's awful. The buses are almost falling down. They're falling apart because the technical people refuse to give maintenance to the buses. Why? Because they think it's discrimination against men. So they're refusing to put gas and oil and change the tires, and so the buses are pretty much falling apart. So we came back and to use the gender budget methodology, not just for the deliverance to the outside population, but also to use the budget for training, to train the technical people, the engineers, and say this is really important for gender equality. This is one of the most advanced measures in the world in the prevention of cases of violence against women. They needed to know the relevance of and the inputs they were giving to the social, to the population, so that they took ownership of it. So this issue about process is really important. You really need to monitor your actions. You really need to know what is the obstacles, what will the resistances be, and how to address them. There will always be resistances. You need to be prepared for that. So your indicators will be threatened if you're not following up very closely the process, and you need to tackle and do measures throughout the process. So gender budgets are result-oriented because we, as I said, we want to diminish the inequality gap. And this goes, we did that since 2002, and it's very interesting that now there is a results-oriented budgets approach, and it's actually very suitable for the type of methodology we were doing, because what we wanted is not to have inclusion of population, but we wanted to see a change in the situation of the population. So results-based budgets is actually very similar to what we used to start doing in the 2002 year. So I'll just go very quickly to say that budgets have a normative dimension. From the start, when you say you only have money for this, it's kind of orienting your action. So that's like the first normative side. But the most important is that it's more technical. And that's the kind of work that you can do with the legislative branch. Because I've been giving examples of the executive branch, but the legislative side has more potential with the analysis of budgets. In Mexico, I've shared these examples with you last year. We have a portrayal of programs that are addressing inequalities, gender inequalities, and we call it an annex. So the federal budget comes. Do you know your federal budget, your annual budget of your country? Have you seen it? It's the list of programs, the sector, the name of the institution, and the list of programs they're implementing, And in the next column, it states what's the entity, because sometimes, for instance, you have justice, but then you have the jail system, or in justice you have many institutions. So you have which is entity, the implementing entity, and then the other column is how much budget they have. So this annex, for gender equality annex, is you cut out those programs of each sector and each institution that are addressing any sort of inequality, gender inequality, and you paste them in a sheet, and you have a list of all of the programs in a nation that are addressing gender inequality. So you realize what sectors are stronger, what are the missing gaps. Usually it's the hard sectors, energy, infrastructure, the military, and the strongest ones are health, education, because those are the ones that have immediate access to the population. But this annex can be done by the executive branch or by the legislative branch. Actually, in the UK and in Australia, it was started by the legislative branch, and now it's part of the regular process of budgeting. In Mexico, we started with the executive branch, but also we did this in 2006, this work with the legislative branch, and now it's a mandate starting from 2008. So we have an article with the explicit methodology that accompanies the program, meaning this article says, what are the requirements for a program to appear in this annex? One of those is that you need to have sex disaggregated data, for instance. But then it also has another cuties, such as incentives, what I'm calling laws. It promotes the transition towards gender budgets. This article states that all the programs that are in this annex have a non-transferability clause, meaning, which is very good if you're running a program. Because sometimes, let's think a hurricane comes, and you have a bag of money, and then the government says, oh, I'm sorry, the hurricane came. And they take away your money because they need to save it, to use it for an emergency. But if you're part of this program, you are protected by the non-transferability clause, meaning this money will only be spent for gender equality. So yes, we're very sad that the hurricane came, but there is no way you're going to touch this money. So that's an incentive for you to protect your program, that you add a gender perspective. And the other clause is non-reducibility. From one year to the next, the government cannot reduce the amount of budget they gave you in this year, because it's a way of protecting the measures that we're promoting in advancing gender equality. So this type of incentive is very good for governments. And we also have another annex that analyzes how many programs are aimed to eradicate discrimination against women, another aimed to portray those that eradicate violence against women, and the third that portrays the programs aimed to achieve gender equality. And finally, this is a very interesting example. It portrays the list of the institutions, and it has 3 columns. How much money are you spending on women? How much money are you spending on men? Or maybe you don't know. And of course, most of the institutions say, I don't know. But it's very interesting because they're obliged to fill the columns, and eventually they will have to say how much money they're allocating and they're spending for women and men. So this normative dimension is very important because you're leading the way to institutions that they report their engagement with gender equality. And for instance, I'm just explaining to you the example of Mexico at the national level and some state level, but Ecuador and Brazil, many governments have engaged, and Morocco, many governments all over the world have worked with gender budgets. So I'll just say, let me move on, before going to the sectors. With gender budgets, you can address policies for the outside world, but also to transform the life of the institution itself. Because also institutions are working with their budgets. If you change that, the actions, the internal actions, then you can reduce the gender gap, eliminate the glass windows and ceiling, the glass windows and the glass ceilings, introduce parity, eradicate discriminatory practices and violence against women. Because now you have, for instance, you train the legal department so that there is no salary gap. And you just do a reallocation of the budget. So this tool is very useful to change the life of an institution as well as to modify the type of policies they're working towards the population. And for all sectors, as I was saying, most of the budgets overall, most of the experiences of gender budgets are addressing the social sectors, health and education. We have many experiences in those fields. But my NGO, I'm convinced that you can use it to transform every sector. And we have worked with infrastructure, with urban furniture, urban planning, highways, transportation, you name it. We've been there and we've changed the programs. So the allocation for the social programs is actually very small. If you do the analysis, the sectorial analysis of the budgetary allocations, the big money is infrastructure, in energy, that's where we want to be. If you know your numbers, you know you want to go and address the big figures because those are having the biggest impacts. So those who think that women are in the social sector, well, let me tell you, they're mistaken. Because those sectors that are not addressing direct population, they're impacting on the second hand or their second turn direct population. So you need to go everywhere. And let me tell you another astonishing figure. Of all the experiences of gender budgets in the world, none of them have gone beyond the 1% of the total budget of an administration. That means that the rest of the 99% of the budget keeps on reproducing or deepening gender inequalities because they're based on the sexual division of labor. So this is why we really need, that's a very good indicator of the state of affairs. How is gender equality at this point? We're convinced that working one by one with each program, you can make a difference. And there are plenty of methodologies. We work with one, but there are many. And this is crucial because we believe that it has to go in strengthening and making alliances with governments because they know their stuff, they're very good, they're really experts. There's not a complot by governments to really screw their population. They're not aware that they're reproducing inequalities. They think, because they're replicating their own patterns. Well, in my house, there is a heterosexual couple who had babies. And now I'm thinking that the rest of the population is made by heterosexual couples. So they are not working through diagnostics, and it's very, very surprising. But they know, when you ask them, at what time women come to the office? Oh yes, they come in the morning, not at lunchtime because they're at school, but then at that time men are the ones who are coming because that's the time they're coming out of their offices. They know where they are, at what time, what ages do they have, what condition, they know. People in the governments know. So this is another shift that gender budgets can do to the measurement of the 2030 agenda, because so far they have been working with statistical commissions, but their work is very specific and is very expensive because they work through surveys, no? The census. But then the institution have the data all the time, every day. So there is that also another part with which we can help building the information and the reporting in a better way, in a more qualitative way. And So, but we really believe that gender budgets would be the way in reducing the gaps by and strengthening states, because at this point they're also hostages to the private sector. So to us it's also an ethical tool to promote this kind of tools in which you're enhancing the work of the states.